Coming in loud and clear.
Excellent, thank you. Good afternoon, everyone. As Bill mentioned, my name is Natalie Balking. I'm the Medical Officer of Health with Haliburton Kawartha Pine Ridge District Health Unit, and happy to provide this weekly media information session on COVID-19 in HKPR jurisdiction. So the format for this afternoon will be similar to our previous media information sessions, and I'll start with an update on the epidemiology or the numbers of COVID-19 activity across the region, provide some updates on vaccination efforts, and then some concluding remarks just about general public health measures and a few reminders as we approach the holiday season. So to start with an update on the epidemiology or numbers of COVID-19. Since the start of the pandemic, we've had a total of 2,612 confirmed cases of COVID-19 across all of HKPR District Health Unit jurisdiction. We currently have 40 active cases, 2 in Haliburton County, 27 in City of Kawartha Lakes, and 11 in Northumberland County. There are 335 high-risk contacts that the health unit continues to follow up with. That number of high-risk contacts is higher than previous briefings, and that's directly related to the number of contacts identified through school cases. So the entire class or an entire class cohort becomes identified as a high-risk contact, and that really pushes our overall numbers of high-risk contacts up. Our 7-day rolling incidence rate continues to creep up. As of today, we're at 22 cases per 100,000 people. To put this in perspective, there are some health unit jurisdictions right now that have incidence rates higher than 200 cases per 100,000. If we look to Northern Ontario, Temiskaming region, Algoma region, are experiencing very significant surges in COVID-19 activity and quite high incidence rates associated with that. Now, our incidence rate has continues to increase and has more than doubled over the last 2 weeks. And I think we should expect that this will continue to rise as we continue to see a higher number of cases that are identified. Our test positivity as of last week was at 2.2%. Across the province, we do have a lower test positivity than many other jurisdictions. But it certainly is increasing and to me signifies that we're seeing an increased amount of activity. The same can be kind of said provincially, that it's a true reflection really in an increase of number of cases. The amount of testing that's taken place is really remaining the same, and across HKPR is somewhat actually less than other regions of the province, but the number of cases we're seeing is continuing to increase. We currently have, or as of this morning, we had 4 outbreaks associated with COVID-19. So one of those outbreaks we have mentioned at previous media information sessions, which is the outbreak at Campbellford Memorial Hospital. There are currently 9 cases associated with that outbreak. There are 7 patients that had tested positive for COVID-19. And then there are 2 visitors that we have linked to the outbreak as their exposure was at the hospital while visiting somebody that was ended up being positive for COVID-19. So a total total cases associated with that outbreak considered to be 9. No cases associated with staff, and I know the hospital continues to work very hard to ensure that there has been and continues to be no further spread in the hospital setting. Other outbreaks currently, there has been an outbreak in one of the school bus cohorts in Haliburton County. Number of cases associated with that outbreak has remained at 3. There have been no additional cases identified. There is one elementary school identified to have a COVID outbreak with 2 cases identified, and then a child care center in Lindsay or in City of Kawartha Lakes with 2 cases associated with it. I did want to give a quick update on COVID-19 activity in relation to schools across HKPR jurisdiction. Provincially, elementary schools continue to be the setting of the highest number of outbreaks. Now, a reminder that the definition of an outbreak is when there are two or more cases that have been with demonstrated transmission within the school setting. So there are many outbreaks that are declared with 2 cases and no more cases identified, but we've certainly seen in other jurisdictions some elementary school cases with greater than 20 cases identified. I was reviewing some media reports earlier today that have indicated that that elementary school outbreaks is currently the highest number it's been since the start of the pandemic, with 239 outbreaks across the province. I think we've been quite fortunate here in HKPR to have not had quite the same amount of activity, but we are starting to see increased activity throughout our school-based population. To date, in this school year, we've had 47 confirmed cases of COVID associated with school-age children or staff of schools. In the last 14 days, there have been 20, so not quite half of all of our school-associated case count being just in the last 2 weeks. There are currently 14 classes that have been dismissed as they have been identified as high-risk contacts, and they are isolating at home, and 3 bus cohorts currently dismissed. So I think while we don't have, again, the same amount of activity as some other jurisdictions, we are seeing an increase in activity and I think fully expecting to see this activity continue to increase over the next couple of weeks. If we look at some of the characteristics in cases identified in the last 14 days, so in the last 14 days, there have been 75 new cases identified across HKPR region. 18.7%, so just about 19% actually in the 0 to 9-year-old age group. So I think that's consistent with what we're seeing associated with school age related cases. 16% of cases in the 30 to 39-year-old age group, and then 16% of cases in the 60 to 69-year-old age group. The majority of cases in the last 14 days have been household contacts. So I think what we're seeing is one individual in the household is exposed to COVID-19, develops COVID-19, and then we see spread within the household. So 32% of cases identified in the last have been as a result of household contacts. 20% of cases with no known source of exposure or transmission, and 16% related to close contact. Of the 453 cases of COVID-19 that have been identified since July 1st, 59% of those cases have been unvaccinated, 4.4% considered to be not yet protected. So they have had 1 dose of COVID-19 vaccine, but it has not been 14 days since that first dose. 11% partially protected. So they have had their first dose and it has been 14 days, or they've had 2 doses, but it has not yet been 14 days. So having some partial protection. And then 25.4% fully protected. A couple other things just related in general to the epidemiology of COVID-19. As people are likely familiar, the Ontario Science Advisory Table has released some updated modeling of COVID-19 for the province. In this modeling, there are a couple of assumptions that were made. So they compare different scenarios. In all of the scenarios, they assume some level of ongoing public health measures. So certainly some capacity restrictions continuing, indoor mask mandates continuing. It takes into consideration the current level of adult vaccination coverage, And then there's different scenarios related to children vaccination coverage. So specifically vaccination coverage amongst the 5 to 11-year-old age group, and with estimates or scenarios associated with if 30% of that age group is vaccinated or 50% of that age group is vaccinated. What the modeling demonstrated, and I guess, again, modeling is, it's a prediction. That the prediction gives different scenarios. There's always an extreme kind of scary scenario, a much less extreme scenario, and we often end up somewhere in the middle, but needing to be aware of what's possible. But really, it seemed to indicate that we're very likely to see an increase in hospitalizations as well as ICU admissions from COVID-19 in January. And this is in direct relation to the current rise in cases provincially that we're seeing of COVID-19. The anticipated surge will put pressure on hospitals. I think at this point it's certainly too early to know, and we're hopeful to I think believe that the surge in COVID-19 activities will not have as great an impact on our health sector or our hospital capacity as the third wave of COVID-19 did, but there's certainly that potential. And I guess what's concerning about the modeling from the Ontario Science Advisory Table is that it wasn't able to take into full account the presence of the Omicron variant. As we're still learning details about this variant, it did have one scenario which attempted to predict if the Omicron variant is more transmissible, so it spreads easier, or what would happen if the Omicron variant resulted in more severe disease. But at this point in time, those predictions for January related to hospital admissions and ICU admissions were not taking into account the Omicron variant. So a couple of comments about the Omicron variant. As you know, it has been identified as a new variant of concern, first identified by scientists in South Africa, but likely didn't originate in South Africa and likely had been circulating globally for several weeks prior to its identification by scientists in South Africa. We have not had any cases of Omicron as of yet in HKPR District Health Unit jurisdiction. There is an increasing number of cases being identified provincially, with several different health units identifying outbreaks and clusters associated with the Omicron variant already. And we can look to London area for a large cluster, Halton region, some other areas that Omicron certainly has been demonstrated to spread quite easily. It does appear to spread more easily than the Delta variant, although it's still relatively early to make any conclusions. I know that there's many scientists around the world at this point in time really working to determine all of these details about Omicron so we can anticipate what its impact will be on public health measures and burden of COVID-19. At this point in time, we don't know what severity of disease the Omicron variant causes. There are some early data from South Africa that it might cause less severe disease. But if we look at overall impact then on the healthcare system, if you have a variant that is more infectious and causes even the same severity of disease, that's going to result in an increased burden on the healthcare system. So I think still quite concerned to see what the impact will be. Also still waiting to see what the effectiveness of our current vaccines will be against Omicron. There's some promising initial data out of South Africa demonstrating some protection against Omicron with the current vaccines that we have available. And I think we will be looking and following quite closely to determine what this will mean for Ontario and what this will mean for our local population. I think we can expect, as I mentioned before, that we will see cases related to the Omicron variant in HKPR District Health Unit jurisdiction. And we can expect over the next couple of months that Omicron will start to become the dominant variant, just the same way we saw the Delta variant become the dominant variant. And as new variants continue to arise, this is likely a repeating cycle that we'll be in as we globally, collectively try to minimize the impact of COVID-19. So I'm just double checking with Bill because I have a sign on my laptop that I have bad network quality. So just double checking that you can hear me okay.
Yep, you're coming through okay, Dr. Bocking.
Okay, I haven't frozen yet. That's good. All right, so I'll move now to some updates related to vaccination specifically. So this data is as of December 6th or Monday of this week. Across HKPR District Health Unit jurisdiction, among people that are aged 12 and over, 87.2% had received their first dose of COVID-19 vaccine, and 84.8% had received 2 doses of COVID-19 vaccine. The province celebrated the milestone of 90% of the population 12 and over having received their first dose of vaccine. And I think we find that we tend to be about 1 to 2% lower than the provincial average, but quite close to the provincial average. We continue to very incrementally move towards 90% coverage in HKPR District Health Unit, and I would encourage anyone that has yet to be vaccinated to seek out COVID-19 vaccine, especially in light of our rising case numbers provincially and locally, and in light of a new variant that's been identified that is likely more infectious than previous variants. Of course, I guess, important news or exciting news has been the rollout of vaccinations for 5 to 11-year-olds, which is the pediatric Pfizer vaccine. Across HKPR District Health Unit jurisdiction, we're at approximately 13% of kids aged 5 to 11 that have received their first dose. We still have many appointments that are open across health unit clinics. We know that there's also appointments open clinics and through pharmacies. So if parents have been holding off to book an appointment, I encourage you to do so. I think rollout has been quite positive, and I think clinics have been well attended, and lots of relatively happy kids. No one's happy to get a needle in the arm, but I think quite supportive of vaccination overall. A quick reminder of who else is eligible for vaccination. So anyone aged 12 and over is eligible for their first or their second dose. 5 to 11-year-olds, so birth year 2016 and earlier, are eligible to get their first dose of COVID vaccine. Individuals with different medical conditions that compromise their immune system, and there's a list of specific illnesses. This group of people can get their third dose of COVID-19 vaccine once it has been 2 months since their second dose. And then there's another large group of people that are eligible to get their booster dose once it has been 6 months since their second dose. And a reminder again of this group, it's individuals aged 70 and over or birth year of 1951, healthcare workers and essential caregivers, Indigenous people, so First Nations, Inuit and Métis and their household members, and then individuals that had a full series of a viral vector vaccine. So if they had 2 doses of the AstraZeneca vaccine or 1 dose of the Johnson & Johnson vaccine, eligible to get a third dose of COVID-19, which would be an mRNA vaccine. The province, as you know, has reported or is expanding eligibility for booster doses. And this coming Monday, December 13th, Anyone that is age 50 and over will be able to book appointments to receive a booster dose of the COVID-19 vaccine once it has been 168 days since their second dose. So it has to have been 168 days between a second and a booster dose. We know, or we anticipate, that there will be high demand for booster doses. I think especially given rising case numbers, especially given just in the last couple of weeks, increasing data on the impact of waning immunity from vaccines over time. And so I think speaking to more of the importance of booster doses and emphasis on why get your booster dose now and to not necessarily wait a couple more months down the road. I encourage, as we know there will be high demand, I want to make sure that everyone is accessing vaccine at all of the places that it's available. So pharmacies have COVID-19 vaccine available. Some of our primary care partners have vaccine available. And then, of course, continue to be health unit-led immunization clinics. The best place to find out most up-to-date information on clinic locations and times is to visit our website. You can book an appointment through the provincial booking system, or you can show up as a walk-in for the last hour of the clinic, which is between 3:30 and 4:30. I think the message, if you're coming as a walk-in, is patience, because we don't know what the lineup might be during that time period. But certainly understand that some people would prefer not to make an appointment and remain flexible and walk in. So finally, I think a couple of summary comments as we move closer to the school break associated with the holiday season and a period of time where we usually see lots of gatherings and really celebrating the holiday spirit. I am going to echo what the Chief Medical Officer of Health for the province has shared, as well as what many other local medical officers of health have shared. And that is that we need to be cautious with our gatherings and our I think, enthusiasm for returning to normal over the holiday season. Given the current trend in increasing cases, I think we will continue to see it increase across HKPR District Health Unit jurisdiction. And now is not the time to be hosting large holiday parties with people from across different households, across different workplaces. Now is the time to be having small gatherings, to be having or engaging in smart planning of the gathering, and also using safe practices so that we're being, small, smart, and safe is our key reminder messages here. I think if you are planning a small gathering, be smart about it. Look at the space that you have available. Consider whether or not you'll be asking individuals that are fully vaccinated to be participating, or unvaccinated individuals. Engage in all of the public health measures we know do work to help prevent the spread of COVID-19. Masking, distancing if you're not able to mask well, washing hands frequently, cleaning high-touch surfaces. But really the biggest practice that contributes to the spread of COVID-19, especially this time of year, is large gatherings indoors of people from multiple households, and that will be in close proximity, talking lots, perhaps singing, but those venues are really the places where we see COVID spread fueled. So I think, again, echoing the same messages, to really be looking at your schedule for the holidays and, continuing with small gatherings, smart planning for them, and safe practices. So I will stop there, as I know I've talked for a long time so far today and would like to leave some room for questions, and happy to take any questions and answer the best that we can for today. Thanks everyone for joining.
Thanks, Dr. Bocking. Excellent points, especially about the holiday season, Save Smart Small. I'm going to open it up to questions from members of the media. You can put up your hands and then we'll go in order. Does anyone have questions for Dr. Bocking? I saw Katrina's hand. Go ahead, Katrina.
Hi, Dr. Bocking, can you hear me?
Yes, I can. Yep, go ahead, Katrina.
Okay, so there's been a call for more access to rapid COVID-19 tests. We know that kids are being sent 5 rapid tests home with them during the holiday break, but I'm wondering if you think these tests should be made more accessible, and could they help contain the spread of the virus if they are made more accessible?
Yeah, so thanks for that question, Katrina. So you're right, as you point out, through the school system, the rapid screening tests will be sent home with kids. I think a couple things to highlight about the rapid antigen tests. So these are tests for people that don't have symptoms, and that are not identified to be high-risk contacts. So the rapid antigen tests, well good, are not sufficient to be that diagnostic test to really, I guess, confirm that someone has COVID-19. If somebody does have a positive rapid antigen test, we then ask them to get a PCR test to confirm. I know that the province is looking at a couple of different models to try and make rapid antigen tests more available, especially over the holiday season. I think that if people have access to rapid antigen testing, it can provide some level of reassurance. But I think we want to also emphasize that we don't want to place all of our eggs in one basket with rapid antigen testing, so that that the tests are being used appropriately. So no symptoms, not a high-risk contact. That if there's a positive test, people are getting a confirmatory test. That really these tests are most helpful if it's being done repeatedly, so every couple of days. A one-off test is not as helpful for the screening approach as some other tests. So I think they can be helpful. I think we need to be aware of in what way they're helpful and that we're using them appropriately. Sorry, Katrina, long-winded answer.
No, I think I said it last week, more information is better than not enough, so I appreciate it. My next question is about kids between 5 and 11 getting the vaccine. I know you said about 13% of kids eligible in the HKPR region have gotten their first dose so far, or as of Monday. What does that equate to when it comes to a number? I'm wondering if you know, as far as how many kids have gotten it.
Right, so we have about 11,000-ish kids. I think the number was close to around 1,500 that had received a vaccine already, but I think I'd have to double check with our EPI team, our data team, to get you the exact number if you're looking for an exact down to the single digit number.
Okay, I think if around 1,500 is accurate, then I think that works for me for my source story. So yeah, thank you so much.
Thanks, Katrina. I have Derek Lewis next. Derek, go ahead with your questions.
Thanks, Bill. Good afternoon, Dr. Bocking. Just a quick question here. We know that the Omicron variant is more transmissible. What makes it more transmissible?
Well, Derek, that's a good question, and I don't have the answer for that. I think that there's lots of different things that contribute to why some viruses transmit easier than others, and it just so happens that this variant has more of the mutations potentially that make it more infectious than some of the other variants. I mean, I think there are other environmental things that sometimes contribute to infection, but as of the virus itself, its genetic material and makeup would help determine how transmissible it is.
Okay, that was good. For someone who didn't have an answer, you gave me an answer. I love it. And the second question, someone actually asked me this week, and I always try to echo a question someone asked to you. So we had a friend of ours who had a COVID-19 test, and he wanted to know if when he got it, he had the results he was looking for, which was fortunate, but he wanted to know, does the Omicron or the Delta or any other variant, does it show up differently on the tests?
So I guess the short answer is no. Let's say for the rapid antigen screening test, it's all of the variants will show up the same way at this point in time. For a PCR test, all of the variants will test positive in the same way. If you have a PCR positive, it just doesn't tell you which variant it is. From there, sometimes there's a specific screening test you can do, and that screen test worked to determine if it was alpha, but then it stopped working because the Delta variant didn't work with that screening test. So really the only way to know for sure which variant is to do what's called whole genome sequencing, where you're looking at all of the genetic material of that virus to determine what it is. But in the end, the lab result that you get back, or when you're told you have a positive PCR test, that's for any of the variants that are currently identified.
Okay, thank you. That was great.
Thank you, Derek, for your question. Next up, we have Catherine Whitnell. Go ahead, Catherine.
Yes, likewise, this question was asked of me the other day. You had brought up the increase in cases in Northern Ontario, and health units have been kind of dialing back some to some of the restrictions. Are you looking at possibly making some of those changes for HKPR, or are we not at that point yet?
So we're not at that point yet. We could reach that point. Definitely restrictions that limit the potential for people to be coming into contact with each other, so limits, capacity limits or gatherings, are a key tool in our COVID-19 toolbox to further limit kind of cases that are increasing. There's not a magic number as to at what point really we say we need these measures to be in place. Our incidence rate is 22 per 100,000. Certainly, if we're getting up, 60s, 70s, 80s, like that's quite high, significant challenges at a health unit level, and we would be considering it like different measures that will help to limit a gathering. So, I mean, I think if people take some of our messaging to heart and limit their gatherings, then we can potentially curb this current increase in cases. If the current trajectory continues to increase and starts to match that of other health units, then I think we likely will move to having some further restrictions in place.
And a second question, you stated that almost 19% of cases in the last 2 weeks have been in children aged 0 to 9, and yet in the last week we've had 13% of our 5 to 11s vaccinated. Is there a correlation? I don't mean to sound like a conspiracy theorist or anything, but is there a correlation to this? What's contributing to the high number of younger children having COVID when it really wasn't believed that they would be as susceptible as adults? That was early on.
Yeah, so I guess a couple of things in there. So one is we were expecting over the fall to see more cases among the unvaccinated population, which includes school children. So they've only just become eligible for the vaccine. So we know that this virus is going to look for people that haven't been infected yet or don't have immunity, and will try and kind of get into those circles. So I think it's not surprising, and it's absolutely expected that we start to see more cases among the younger population. I think what we're seeing is that if we had rolled out vaccination among this age group 2 months ago, we might not be seeing the same numbers, but it wasn't available then. So it's only just become available, very small proportion that's covered already. And so I don't think we would expect to see the same protective effect at a population level yet among this age group as we have at older age groups. Children are certainly can certainly get the virus just as easily as anyone else. They're less likely to become sick with it, and certainly much less likely to become sick enough to need to be admitted to hospital. But they can certainly get the virus to the same degree as anyone else, and also have the ability to spread it onwards the same as anyone else.
Thank you very much for your information.
Thanks, Catherine. I'm just going to open it up. There's one other reporter on the call, and that's Sue Tiffin from the Echo. Do you have any questions, Sue, before we open it up to others? I don't know if she hears me. Okay. I guess, Derek, I see your hand is up. Did you have another set of questions?
Just one question, and then I'll let you go for myself, at least for the day. For people who have had, there are a number of people who've had COVID and they just have flu symptoms, and they basically ignore the fact that they have COVID. They just think they have a cold or something. When they do get over it, are they more susceptible to getting sick again, or does their body build up almost a somewhat more of an immunity to it?
So with almost any virus, most viruses, once your body has been exposed to it, it builds up some antibodies that help your immune system remember that virus, so that if it comes into contact with that virus again, it's able to fight it off. To date, and this is without the Omicron variant, individuals that have had COVID-19 infection could get reinfected with COVID-19, but it would seem to be happening at a fairly low level. It has still been recommended that if someone has had COVID-19, yes, they're likely to have some immunity, some memory cells, but that it is still beneficial to get vaccinated, which seems to really boost those memory cells even further, and so that you really have a good, robust immune response if you're exposed to COVID-19 again. One of the things that I think people are concerned about with Omicron is the possibility of reinfection, and whether or not that reinfection risk is higher with Omicron. And I think that's one of the details still we don't have enough data on yet, and really waiting to see. And as such, the message is yes, while there's likely some immunity after having COVID-19, there is still absolutely benefit of being vaccinated, and good evidence that having a vaccination after having been infected has a very good boost to your immune system should you be in contact with COVID-19 virus again.
Fantastic. Always the rock star. What a great answer. I love it. Thank you.
It was long. Eventually, I'll cut stuff down in another 15 years or so.
No, the long answers actually give me a lot to work with. Don't edit yourself. It's perfect.
Rockstar. There you go. Put that on your business card there.
My
Dr.
business
Bach.
card. Yeah.
Thanks, Derek. We have a question, I guess, now. Sue, go ahead.
Hi, Bill. Thanks for suggesting that I ask something. Now I will. I was going to let Dr. Bocking off the hook, but I suppose not this week. I have a question about I have a question about what you might be seeing, and I'm not sure if you're tracking side effects from vaccines. So I'm just wondering if you're seeing any sort of trend in what kids are experiencing in terms of side effects after the vaccines, and what people are experiencing after the third booster shot. So I know that obviously that varies for a lot of people, but I just didn't know. I'm hearing like just different things from different people. So I'm not seeing that anybody's all experiencing the same kind of thing, but maybe you are. So
no, that's a good question. And I guess to remind people, and you can help to remind people, really any we call it adverse event or side effect from the vaccines are reported to first your local public health unit, and then we enter it into the provincial database system so that there's numbers all together at a provincial level, and then those numbers get fed into a national or federal level system so that you can then summarize across all of Canada. Because the more numbers you have overall, the easier it is to identify trends, especially rare trends, and that's how you might identify very rare side effects. There's obviously not a ton of data yet about either third doses locally or booster doses locally, or side effects for 5 to 11-year-olds locally. But I can say based on other jurisdictions, so for example, as the vaccine has rolled out among the 5 to 11-year-old age group in the States, what the initial data is showing is that kids seem to have a slightly higher rate of local side effects. So sore arm, red spot, sometimes itchiness, maybe a little bit of swelling. And they seem to have a lower rate of broader side effects like fever or full body aches, that sort of thing. For booster doses in adults, I haven't seen any data specific to that. I know Public Health Ontario is putting out weekly reports related to adverse events. Anecdotally, I've had some friends and colleagues say that they seem to experience more side effects with their third dose, but then I've also had some say that it was either the same or less. So I don't think that there is a conclusion right now in terms of whether it's more severe or less severe. I think everyone seems to be experiencing it a little bit differently, but the side effects associated with the booster dose are really still the same as what you had with the first or second dose. So you can have the local side effects, sore arm, red arm, swollen arm, or kind of full body side effects, fever, headaches, feeling tired, sometimes nausea, kind of more broader side effects. So I don't know, that probably doesn't fully answer your question, Sue, but probably the only information I have right now.
No, that works. Thank you. And the other question I have is, can you just speak for a moment to what parents need to do in terms of this vaccine regarding the vaccination process? So, if you get a chickenpox vaccine, you need to report that to the school. Do parents need to do anything after they get their children vaccinated, or are they just good to go?
At this point in time, they're good to go. When the child receives the vaccine, it automatically is entered by staff at the vaccine clinic into the provincial system. And so, if a receipt is ever needed, parents can download it. There's no direction right now to automatically report that to the school board, and it doesn't need to be reported to the health unit. If the child is identified as a high-risk contact later on, then the health unit can access their vaccination record in the provincial system to determine whether they've received their vaccine or not. So really, parents at this point in time, just keep your own records for yourself. And if you're like me, you have a yellow card somewhere in the house, but you don't need to do anything special.
Okay, I really appreciate that you also perhaps do not know where your yellow card is, although like many of us, it's somewhere in the house. And just to clarify there, because you mentioned health unit and school, what about family doctor?
So not all family doctors have access to the provincial database with the vaccination record. and the immunization record from the health unit or from the vaccine clinic is not automatically sent to the family doctor. So I would encourage parents that to either drop off a copy or, next appointment they have to bring a copy just so that your family doctor is aware.
Perfect. Thank you.
Thank you, Sue, for that question. Just a quick update to Katrina's question about the number of kids vaccinated. Epidemiology just got back, and there were actually 1,471 kids aged 5 to 11 who are vaccinated first dose since Monday. So that's pretty good math, 1,500. So is there any other questions for members of the media? If there aren't, thank you again for attending. We appreciate your help to spread the information. We certainly appreciate Dr. Bocking's time to speak to some of these issues and answer questions. So thank you again for attending. We have another session booked for this time next week, and we'll see you all then. Thanks, and have a great rest of the day.
Thank you, Dr.
Thanks very much.
Thank you for those numbers, Bill. I really appreciate it.
No
Yes,
problem.
thank you, Bill.
Take care, everyone. Thank you, Bill, for hosting.
Take care.